Hello, everyone. I am Nicole Terhune. I am a licensed clinical mental health counselor and a licensed alcohol and drug counselor. I'm also trained in EMDR therapy. So I primarily work with adolescents who have experienced trauma and or anxiety, depression, as well as substance use disorders or substance use within the family. Today, I'm going to be talking to you a little bit about adolescent alcohol use. It happens often, and there are some things that adolescents don't know about alcohol, and also as parents and guardians that we don't know about alcohol. So I'm hoping to share some things that will be helpful with you today. And let's get started. So, of course, I had to start with the history of alcohol, this fun fermented green fruit juice that is traced back to India and China from 7,000 BC. So it has been around for quite a while and has made some significant history for real when we think back about, just the world and things that people have been through. Alcohol has been sort of a part of our society for a very long time. Something that I do talk with adolescents about are the drinking laws. I have had adolescents who have lost their license due to they're simply out, the night before and have had a night of drinking, and they will get up in the morning early sometimes because they cannot sleep, and they're just experiencing the impacts of interrupted sleep from alcohol. So they will get up and think that they're fine and end up, getting pulled over or in an accident because they're actually still under the influence. So I've worked with adolescents who've ended up on probation because of this, as well as working through fines, community service, and navigating that system. So I always tell the adolescents that I work with, just don't do it. Don't drive if you've had a drink. And you'll see later in the presentation that alcohol impacts the brain for up to 12 hours, which they don't realize. We often hear the drink an hour rule, which is very different for adolescents than it is for adults. But alcohol actually impacts the body and the brain for up to 12 hours after just having one drink. So there's some significant things that we need to understand here about the laws of drinking and how alcohol impacts the body. A big question here: what drug category is alcohol? Is it a stimulant? Is it a hallucinogenic, a depressant, an opiate? So it is a depressant. However, it is common that people or adolescents think alcohol is a stimulant because a lot of times when someone has that first drink, or, I've worked with adolescents who they feel socially awkward. So when they're drinking, they feel much more confident about themselves, and it gives them energy, makes them feel bubbly, makes them feel excited. There's some things that happen within the body with that first drink, which makes it feel like, there's a boost of energy, that it's helping with their focus or giving a heightened sense of positive feelings. However, over time, depending on that person's body weight and the amount that they have drank, the alcohol begins working in the body like a depressant. So it's going to have those sedative effects, which, can lead to somebody passing out or being lethargic. Some other depressants that I have on the bottom here: Xanax, Valium, Ativan, and Klonopin. So here we have an example of how a depressant works. So it's going to bind to the GABA receptors, which actually those receptors produce calm, sedation, and then the alcohol is going to inhibit glutamate, which can cause memory loss, impaired brain functioning. And then there's a release of dopamine, which then allows somebody to drink more. And this is where, building a tolerance comes in, and that feeling of, I need another drink to start feeling those feelings again that, the adolescent was originally having. As I said before, the more alcohol that's consumed, the more the depressant begins to take the effect. So dulling the senses, it impacts concentration, all that stuff. Here's just a chart of the average percentages of alcohol in a beverage. And what I like about this chart is the size of the glasses. So if you look at that wine glass, it's about half full. The glass of the liqueur, that's about 3/4 of the way full. So when somebody says that they've had one drink, how much is one drink? How much was in the cup? How much were they actually consuming? What is the percentage of the beverage that they consumed? And that can be, really impact someone's blood alcohol and make somebody feel like, well, if they're having a glass of wine that's, full to the top, is that one or is that two? I think it's, most likely that would be considered 2 glasses actually. So just being aware of that is important. Binge drinking. So according to the research that I found, apparently the moderate drinking is for women to have 1 drink per day, and men it's 2 drinks per day. I would say there's probably some fluctuation there, given body weight and tolerance. But this is how it is defined from the research that I found. So as far as binge drinking goes, for women, it's 4 or more drinks in one setting. And for men, it's 5 or more drinks in one setting. The blackout myth. So I'll have a lot of adolescents who will tell me I blacked out, totally passed out, didn't, I don't remember the whole night. And something I always try to share with them is sometimes blacking out can actually happen while you're awake. When I'm treating a client and, we're working through trauma and they might not remember anything that happened to them because they had been drinking, that is also a blackout. Even if the person is awake and conscious, the brain, the memory is shrinking when someone is consuming alcohol. So that part of the brain is, blacking out and not able to recall the information. So it doesn't always mean that somebody's passed out on the floor like they picture. It really could just be that, there was a beverage that was had or more. And I guess it also could happen if, someone hasn't eaten all day and they're on medication and they have one drink. It's very possible somebody could black out during that time. It just kind of all depends on how the alcohol is consumed within the body. And as you can see here, it can last for a few minutes or much longer. Alcohol poisoning, we most commonly know that as, somebody is vomiting, but here are just some other indicators. If someone has an inability to feel pain or is unconscious, slow or irregular breathing, cold, clammy, blue skin, and possibly death. This is a chart for alcohol impairment, and what I like about this chart is it says, it's only safe to drive if you have not had a drink. Like I said before, it's not safe for especially adolescents to drive after they have had any sort of beverage, but you can see based on the body weights and the impairment begins even with that first drink. And then here's the chart for women. So blood alcohol concentration, yes. Adolescents are funny because they know, they know the legal limit, which is interesting because it's not legal for them. But this chart goes through and talks about how, at 0.02, this is the level of intoxication. 0.08 is the current legal limit in the US. Then we get down to where blackouts begin, which we talked about before. So this is sort of the percentage on average of where that might happen. So here's a better chart just to show those levels. So it's, it says 0.02% is almost like having 2 beers. That person's going to have loss of judgment. Then the next step is about 3 beers, reduction in coordination, and then it goes on from there. And again, this is all an average. This is just a baseline system, but depending on somebody's tolerance and body weight, this could be very different for anyone. I've had adolescents tell me they had 1 drink and they've gotten in, car accidents or had bad things happen. So it depends on how often they drink, what their tolerance is, and how much their body can actually handle. So here's a list of effects of overuse of depressant, a depressant like alcohol. It's pretty self-explanatory, but seizures, nausea, slow breathing, dizzy, fatigue, feelings of depression, that is something that we will talk about. And let's see if I can show this short video. Just describes how alcohol works in the brain. And I do show this to clients sometimes.
Alcohol, one of the most commonly used and abused drugs in the world, comes in a variety of forms and does one thing quickly and well. It changes the way you feel. But to what do we owe these feelings of release and freedom? How could the ingestion of one simple substance so drastically change not only your actions, but thoughts and perception? As alcohol enters the body and makes its way to your brain, it begins to interact with your neurons or brain cells. In our previous video on marijuana, which you can click here, we explain the actions of neurons and their chemical messengers called neurotransmitters. But there are two main types of neurotransmitters that these neurons use to communicate or send electrical signals. Excitatory neurons use glutamate, while inhibitory neurons use GABA, the yin and yang, if you will. Much like the zeros and ones of a computer, these two messengers have contrasting roles. Glutamate begins a wave of excitation, while GABA not only inhibits this flow, but helps to organize and differentiate the results in your brain. And just like a computer, these signals can be combined in enormous complexity to form actions and thoughts. So how does alcohol affect these two signals? Turns out it suppresses glutamate transmission and enhances GABA transmission, so you get less excitation and more inhibition. And because glutamate sites become less effective, information flow becomes slow, and only the largest signals can make it through. This means you feel less, perceive less, notice less, and remember less. In conjunction, the increased GABA hushes the excessive background noise of activity, fine-tuning and clarifying your thoughts, but to an excessive degree. This is why you may have heard that alcohol is a depressant, but inhibition of your neurons is not the same as social inhibition. Instead, it simply cleans up and removes extraneous activity by removing less significant excitation. Without normal GABA transmission, the excessive excitatory action would resemble an epileptic seizure. There would be no clarity of thought. While drunk, your GABA channels are wide open. Combined with the lack of glutamate, you begin to think very little, but with great clarity. It's what causes the momentous attitude of a drunk, often repeating the same idea or proclamation over and over, thinking clearly about almost nothing. Got a burning question you want answered?
Okay, so that gives a better picture of how alcohol and the neurotransmitters and GABA and how all of that works. And give me just a moment while I switch back here. Let's see, how did I do this earlier? One. Okay. So I just wanted to show these advertisements. You know, we've got the beach, gaming. This is what our children, students are seeing every single day. These are not pictures of people in rehab. These are not pictures of people experiencing significant addiction and being hospitalized. And, you know, although alcohol can be enjoyable, it also can tear families apart. So these messages are really colorful, bright. They, you know, made with 100% American grain. That's great. You've got the video games, people cheering. It's a social norm that you should be drinking when you are hanging out with your friends. And so these are just some examples of advertisements that our adolescents are seeing. So some of the risk factors of why someone might begin drinking is if somebody is experiencing symptoms of ADHD, anxiety, trauma, if there's any predisposed alcoholism in the family, stressful home life, isolation, which we all can understand that in these past couple of years. Kids are lonely, they don't know what to do, they're bored, so they're looking for ways to entertain themselves. Drinking can be fun, drinking can be funny. And lack of sleep. So I'm tired, I need to be awake, I'm hanging out with my friends, I should just have a drink. Grieving, avoiding those feelings, those hard feelings. Let me go back to ADHD. So those kind of symptoms where somebody might be experiencing heightened sensations or high motor. Alcohol is a depressant, so it can make that person feel leveled out, calmer. Same thing for anxiety, feeling stressed. They have a drink to calm the nerves and feel better. However, a lot of adolescents don't understand, and adults as well, that alcohol can also cause anxiety, because once the alcohol is wearing off, anything that you had been experiencing or struggling with the day before that's gone unresolved, that's coming back, 10 times harder. And your brain doesn't have the ability to adjust to your sober self that quickly so that you can handle those feelings of stress and anxiety. So risk of substance use is more along the lines of beginning to talk about, we're getting closer to talking about addiction, but, substance use in general, but this is also related to alcohol. So it can affect the growth and development of the brain. As we know, the adolescent brain isn't fully grown, the prefrontal cortex, until somebody is around 24. And I've heard different numbers, but in the research I did recently, it mentioned the age 24. I think it can be different for men and women. However, in general, we can just say 24. So the more often someone is using a substance, they might, experience partaking in risky behaviors, dangerous driving. It can absolutely impact their development into adulthood and cause more stressors, also health problems such as heart disease, high blood pressure, and sleep disorders. And as you saw in the video, this is kind of reviewing how alcohol impacts the brain. So these are all the different parts that, consuming that first drink is going to impact all of these systems. Here's a study that was done of somebody taking a memory test, a working memory test. So as you can see on the screen, the brain with more pink and red, this is a person who is a non-drinker and their working memory is more accessible during the test. And then the 15-year-old heavy drinker, their working memory was not hardly accessible during this test. So heavy drinking impacts working memory. Okay, This is one of my favorite questions from adolescents, especially if they have to provide a urine sample or a drug screen. So yes, alcohol is getting eliminated from the body. However, it can show up in a blood test for up to 12 hours. That is significant. Significant. It can be detected in urine for up to 3 to 5 days and 90 days in someone's hair. I have worked with adolescents who try to fake their drug screens. So if this is something that you're asking from the adolescent at home with you, or they're having to provide a drug screen in a program that they're in, people have found ways to do this. So I've seen kids use other people's urine, and they will like bring it in a balloon and put it in their pants. And I know it's very extreme, but yes, it does happen. And also there are some detox drinks out in the market that they find access to. I think a couple years ago, there was like some kind of Jello on the shelf, a Jello drink they were using. And sometimes it works, unfortunately. A lot of the tests that get sent out to a lab can detect if there's something wrong with the urine, and then the program that the adolescent is in, or the person providing treatment would be able to tell. But the at-home tests would not likely detect if somebody was faking a test. So with adults, there's less supervision when someone is giving a urine sample. So it's much easier to know if somebody's faking it or not. But these are circumstances that do happen. I've worked with adolescents in an IOP program, and they will try to fake a urine test. So we've answered some of these questions. How long is impairment after one drink? We talked about how that can be 12 hours. Letting my child drink at home. I've heard this many times, that some families feel, I'd rather them drink at home with us so that we are supervising them and we know what they are doing. I will caution you with that, because if they are drinking at home with you, they are likely drinking other places. Drinking at home is not going to necessarily prevent somebody from becoming addicted to alcohol. The younger somebody is consuming alcohol, the more they are at risk for becoming addicted, because the brain really, really can begin to crave that. And the more somebody starts to consume and build a tolerance, they're more susceptible to addiction. So allowing your child to drink at home, I understand in your heart and in your hope that this is you being able to supervise, your child. However, there are some concerns as well with that. Taking a tolerance break. So some adolescents will take a tolerance break from alcohol or marijuana or other drugs to get their body back to a place so that they can still feel the effects of alcohol as they did maybe when they first started drinking. So if somebody has built a tolerance to alcohol, meaning, they can drink 5 drinks without, quote unquote, feeling drunk. Somebody would take probably a extended break from drinking so that their body can get back to a place where, oh, I haven't had a drink in this amount of time. So the tolerance reduces, and then they will have maybe a drink or two and feel the effects sooner. We already talked about drug testing. This is probably something that most people are probably most curious about. So the signs of dependence. There's criteria for this that a therapist would use, or somebody assessing someone would use, and this is part of that criteria. So drinking more than intended, trying to cut back and can't, spending a lot of time drinking or being sick, craving alcohol, finding that drinking or being sick often interfered with taking care of something at home or family or school, or interfering with jobs, continuing to drink even though it's causing problems. And someone is typically diagnosed with a dependence, alcohol dependence, if 2 of these symptoms have occurred in the past 12 months. Giving up or cutting back on activities that were important or interesting. Getting into situations that increase someone's chances of getting hurt. Continuing to drink even though someone is feeling depressed or anxious. Drinking more than you once did to get more effects, which again goes along with tolerance. So someone might take a tolerance break, or they might be drinking more so that they can feel the effects. Withdrawal symptoms such as trouble sleeping, shaking, anxiety, depression. These are the stages of change. So when somebody's thinking about stopping their use, we talk about these stages of change. And the stages of change can apply to many things in life, which is great. I really like this model. So we would start by talking to somebody, figuring out where they're at in this circle, and where are you in the stages. And it's a very powerful tool to help someone identify, what does it mean to recover? What does it mean to get better? What does it mean to work on myself and make change? So if someone is pre-contemplative, they have no intentions of changing that behavior. Contemplation, they're aware that a problem might exist, and they're not willing to make an action plan yet, though. Preparation is, okay, I'm going to take action and make a change. Action, so they're changing, they're going to start maybe drinking less or have a plan. Maintenance, so maybe this person has stopped drinking altogether and found other healthier ways of coping. Relapse, so this is when a person begins drinking again, and then it's the upward spiral, so the circle starts again. So treatment types, we have outpatient therapy, that would just be like private practice or one-on-one therapy. Intensive outpatient, so that might be like an IOP program where someone is going multiple times a week for multiple hours in that day. Partial hospitalization, and then residential inpatient services. There's still lots of treatment options now. I highly recommend an adolescent attend an AA meeting. AA is one way to recover, but it is not the way. Some people really resonate with AA, and for some, it is not their preferred way. However, it is eye-opening. It's an eye-opening experience. Something I do want to highlight is the piece about mental health and how our adolescents have been adapting a lot. They are doing what they need to do right now. And I know that a lot of them struggle with anxiety, depression, and alcohol can be a very quick way to fix that feeling. However, it can easily and dangerously lead to a hard situation, addiction, and sometimes it doesn't. And that's what's hard too. You know, they see their friends and say, well, they didn't get addicted. It's hard to know, you know, who it's going to be a problem for and who it won't be a problem for. But all of this information, these are the things that I use with my clients, my students. It has been effective. I have lots of resources for adults and adolescents. If you have any questions, please reach out to me and send me an email, and I will get back to you as soon as I can. I'm a little bit slow with responding to email. However, I will do my best to answer all of your questions. Thank you so much for watching. I appreciate your time. Take care and be well.